Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. Today's show is called Dr. Jeffrey Tauth Heart Attack Warning Signs. Most ignore and trust me, it's juicier than your cousin's peach cobbler. Let me hit you with a statistic that'll knock your socks clean off. Every 36 seconds, someone in America dies from heart disease. But here's the kicker that most people don't know. Most heart attacks actually give warning signs 30 days before they strike. 30 whole days. That's like your heart sending you a registered letter saying, "Hey, dummy, pay attention to me." But we're all too busy scrolling through social media and binge-watching Netflix to notice. Today I'm going to share 3 critical early warning signs that could literally save your life. And I'm talking about the sneaky ones that most people completely ignore until it's too late. First up, let's talk about unusual fatigue. Now, I'm not talking about being tired after you've run a marathon or spent all day chasing your grandkids around the yard. I'm talking about feeling like you've been hit by a freight train after doing simple stuff like climbing a flight of stairs or pushing a grocery cart. This is your body waving a giant red flag and screaming that something ain't right. Women especially need to listen up here because y'all experience this weeks before a heart attack more than men do. It's like your heart is that friend who keeps dropping hints about their birthday party, but nobody's picking up on the clues. Your heart is struggling to pump blood efficiently, so everything becomes exhausting. If you're suddenly feeling like climbing stairs is equivalent to scaling Mount Everest, maybe I should see you in the clinic. We need to talk. The second warning sign is chest discomfort, and here's where Hollywood has really messed us up. We're all expecting that dramatic scene where someone clutches their chest and drops to the ground like a sack of potatoes. Reality check, that's not how it usually happens. Most of the time it feels more like someone's sitting on your chest, or like you've got a really tight belt wrapped around your rib cage. It often feels like pressure, squeezing, or fullness right in the center of your chest. The tricky part is it comes and goes like that annoying relative who keeps showing up uninvited. It might last a few minutes, then disappear, making you think everything's fine. And here's the real kicker, so it can feel exactly like heartburn or indigestion. I can't tell you how many people I've seen who spent weeks popping antacids thinking they had a stomach problem when their heart was actually crying for help. Let me tell you about a patient I treated recently. Sarah was a 52-year-old teacher who'd been dealing with unusual fatigue for 3 solid weeks. She kept telling herself it was just job stress because, let's face it, teaching these days is like being a lion tamer without a whip. She also started getting what she thought was heartburn after meals, so she kept downing antacids like they were candy. When she finally dragged herself to my emergency room, our test showed significant heart damage. Yep, entirely true. I can't make this stuff up. The really heartbreaking part is that if she'd come in when those symptoms first started, we could have prevented permanent damage to her heart muscle. Her heart was like a car engine running on empty, but she kept trying to push through instead of pulling over for gas. The third warning sign is a shortness of breath, and this one's particularly sneaky because it doesn't always come with chest pain. Picture this. You're sitting on your couch watching TV and suddenly you feel like you just sprinted up a hill. Or you're doing light housework and you're huffing and puffing like the big bad wolf trying to blow down the 3 little pigs' house. This can happen months before a heart attack because it's a sign that your heart isn't getting enough oxygen-rich blood. Think of your heart like a high-performance engine. When it's not getting the premium fuel it needs, it starts sputtering and struggling to keep up with demand. Here's your actionable takeaway, and I want you to write this down or tattoo it on your forehead if necessary. If you experience any 2 of these symptoms together, unusual fatigue, chest discomfort, or unexplained shortness of breath, don't you dare wait around hoping they'll go away. Call your doctor immediately. Don't be that person who thinks they're being dramatic or wasting someone's time. Your life is worth more than avoiding a potentially awkward phone call. Early detection isn't just important, it's everything. It's the difference between a minor tune-up and a complete engine overhaul. Trust your body when something feels different because your body doesn't lie to you. It's usually smarter than your brain when it comes to knowing something's wrong. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.